Welcome back to the channel. Did you know that in 2022, 23% of people had visited a mental health professional? That's a 13% increase compared to 2004. With more people seeking therapy, billing departments are seeing an increase in the number of claims they need to submit. And here's the thing, when you're dealing with therapy, coding can get a little complicated, with the different types of therapy, session lengths, and reasons for seeking help all play into the coding process. So, what exactly are CPT codes? Well, CPT stands for Current Procedural Terminology, and it's a standardized coding system created by the American Medical Association, or AMA. These codes are used by healthcare professionals to describe medical, surgical, and therapeutic services. In simple terms, they're like a language for insurance companies and billing departments to easily understand what happened during the visit. Each time you visit a mental health professional, they assign a CPT code based on what happened during the session, whether it was a regular therapy session or a family therapy session, or even an emergency therapy session. So let's talk about specific codes you'll most likely see when it comes to therapy. And just a heads up, this can get a little specific, so stay with it. If you're seeing a therapist for a regular 30-minute session, they'll likely use a CPT code 90832. In a 45-minute session, that code will be 90834. If it is a full session of 60 minutes, this CPT code will be 90837. But wait, therapy isn't always for individuals. Sometimes you're there with your family. For family therapy, you'll see the CPT code of 90847, which is for a 50-minute family session. And if you're there in times of an emergency, when it comes to urgent sessions, for those crisis sessions, the codes are a bit different. A 60-minute emergency session would be the CPT code 90839, and if it's an extra 30 minutes on top of that, you will use the code 90840. When a billing department receives the claim, they will make sure the documentation is correct. That's the first step. The insurance company needs to see that the service was necessary. If the documentation's good and the CPT codes are used correctly, then the claim can move forward. But if things aren't documented well, or if the wrong codes are used, that's where things can get tricky. Claims can get denied and also sent back for corrections. Billing departments need to confirm if the provider is in network or out of network with the insurance company beforehand. If the therapist is in network, the insurance company is obligated to pay the agreed upon amount. If not, the patient may have to pay the entirety of the bill. That is why it's important for billing departments to stay updated on CPT codes and their changes. For example, in 2025, there will be 420 changes to CPT code list, including 17 new telemedicine codes. If your team isn't on top of these updates, you might end up using the outdated codes, and that could lead to delays or claim rejections. As you can see, while medical health billing can seem complicated, it all boils down to understanding the right CPT codes and keeping everything accurate and up to date. With more people seeking therapy now more than ever, it is crucial for your billing departments to stay on top of these changes and ensuring the process runs as smoothly as possible. By doing so, you can help therapists get paid faster and reduce the risk of the claim denials, ultimately benefiting both provider and the patients. If you want to learn more about CPT codes, reach out to Tactics. And since you made it this far into the video, you might as well like it, share it, and comment down below.